Hi, we are Team Genesi, and our team number is team number 1046, and this is our video for the 2020 Bench to Bedside competition. My name is Erica, and shortly you'll be hearing from my teammates Joe and Alyssa regarding our product. So the problem, best clinical practice mandates that blood loss following vaginal delivery is required to be quantified in order to monitor for and prevent postpartum hemorrhage. Postpartum hemorrhage is defined as greater than or equal to 500 milliliters of blood lost following delivery of the baby. Postpartum hemorrhage is associated with 1 in 4 maternal deaths worldwide, and the U.S. is currently ranked 65th among developed nations for maternal mortality, and this is rising. In the United States, over 1/2 of maternal deaths are considered preventable. It is well described among OBGYNs and other providers who perform vaginal deliveries that the devices currently available on the market for quantification of blood loss are inadequate. First, the current devices, primarily medical drapes, do not capture all of the blood expelled, letting blood fall to the floor and on other surfaces. Second, the current devices capture other fluids, such as amniotic fluid, urine, and feces, that are expelled prior to the baby's descent with the blood lost. This leads to subjective estimation of blood loss, usually underestimation in the clinical setting, which results in poor maternal health outcomes. Our device provides accurate quantification of blood loss in order to prevent postpartum hemorrhage and identify it early on.
For the market assessment, we found that maternal postpartum care expenditures add on average 45% to the delivery costs, which is roughly $10,000 per birth in the United States. On average, 140 million births occur worldwide annually. This includes vaginal and C-sections. The global postpartum hemorrhage device market was $742 million in 2019, with a CAGR of 5.10%. It is projected to cross $1.2 billion by 2025. On average, of the 140 million births, around 14 million women suffer from postpartum hemorrhage. Based on market share data from competing companies, we estimate that we will be able to capture 10 to 15% of this market. Our production cost is estimated at $3.14 per unit at a volume of 100,000 units. Direct cost savings is estimated to represent a return on investment of 357% versus the acquisition cost of our device for our buyers. We plan to price individual units at $10. If bought at a volume of 100 units, the price will be $7 per unit. As at higher volumes, we will lower the price accordingly, and prices can be negotiated with buyers based on how much they need. Our revenue forecast can be seen here. Our total devices sold is planned on having a partnership with the U of U OBGYN ward in the first year and expanding from there to most of the United States by year 5. With this projection, you can see that we have a projected gross margin of close to $2 million by the end of the 5th year. There are further details in the competition packet.
Next, Joe is going to give you information on the product.
Genesi is a novel device for the collection and quantification of blood lost during childbirth. It features a retention plate and a collection chamber. The retention plate is placed beneath the patient during childbirth in order to maintain the position of the device in use. The collection chamber is of large capacity to accommodate for significant blood loss scenarios. The rounded front and raised sidewalls ensure that none of the blood loss is going to be missed by the device. The base of the collection chamber slants downward toward one end with a recessed port, which connects to standard suction tubing. Blood can flow down toward the recessed port, where standard house suction can evacuate the blood to be easily and quickly measured. The device is lightweight and simple to use, meaning healthcare workers can quickly and easily place it beneath the patient immediately following the delivery of a baby with minimal effort and without extra training. The device can be injection molded and is sterilizable, making it a very cost-effective single-use device.